I cried when I heard that I had to get an amputation. I really did. My name is Leroy Thompson. I'm a diabetic. I've been here at Prisma Health for 17 to 18 months. I got diagnosed with diabetes about 15 years ago. My wounds started when I was 29. I had my first symptoms of vision loss. It went from vision loss to insulin, from insulin to the pills, and for the pills and the amputation of my foot, and then the amputation of my toe.
The 29203 zip code is a problem area for amputations in diabetic patients. From Mississippi to the coast of South Carolina, it's one of the highest areas for lower extremity amputations, and it's really multifactorial. Higher incidence of diabetes, lack of access to certain specialties, severity of illness. It's a widespread problem within this area, and I'm seeing it getting larger and larger.
The first time that I met Dr. Klein, he put hands on, and that made me like, well, okay, he's touching me versus the others. The others would tell the nurses to do the work. He did the work, and that's a big difference. If I would have had Dr. Klein when he was working on my foot the first time, I would still have a foot. Really, I would, because he did amazing things for me with the foot that I still have.
Hyperbaric oxygen treatment is one of the therapies that we use to treat diabetic ulcerations that become infected and hopefully prevent them from going on to amputation. So it's one of the tools in our toolkit that we use to take care of diabetic foot ulcerations.
Many people ask what a hyperbaric chamber is, and really the magic that we do here is from the oxygen, not from the chamber. The chamber is a means to an end, and because we have to increase the pressure so that we can have more oxygen get into the body. And the only way we can do that is with an enclosed, sealed space. And so the chamber is merely a means to an end, and it's basically a tube that allows us to increase the pressure.
When I got into the chamber and got out for that hour and 20 or 30 minutes, I went home. I washed and waxed my car with one foot and crutches, okay? That's how much energy that I had that first day once I got in this machine. It changes my life. It changed my life totally.
The new facility at the Baptist Hospital is going to be a tremendous asset to the community in so many ways. It will be a multidisciplinary type of center, so we'll have specialists from podiatry to internal medicine to infectious disease, surgery, people like Dr. Cohen who do hyperbarics. It truly will be an asset in so many ways to save limbs and in turn to save lives to our community.
We're extremely pleased to have the foundation be supportive of this project. This is an extremely important project. The rate of diabetes in our community and across the country is significant, and the complications that these patients that suffer is really horrendous. We really don't have the capacity to take care of a lot of these folks under the current circumstances. And so this will provide that capacity for us to reach out to the community.
The people that was helping me along the way was Dr. Klein and Dr. Cohen. And being inside the HBO chamber, it healed even more from the inside out. And it was, wow, it's an eye-opener. It's a machine that saves lives. It really is.
We all know somebody who's been affected by diabetes, whether it's diabetic foot ulceration, neuropathy, kidney disease, blindness. I'm asking all of you to support the Prisma Health Midlands Foundation, and if you help with this capital campaign, you will save a limb and you will help save a life.